All right, welcome everybody. We're so excited that you're here. Hope everybody's having a great day. We're going to let people come into the webinar. If you can, in the chat, please let us know where you're coming into from around the world. We always like to know where people are. Charlotte, yes, dear. I'm actually in Raleigh. Okay, we'll get started shortly. We just want everybody to get a chance. Maryland. Oh, yes, that's right, Daryl. I remember. Arizona, Alberta. Arizona, I know it's like 150 degrees out there right now. Oh my gosh. All right, so let's get started. Let me move this. Okay, so my name is Shelly Myers, and I'm the business success coach for Practice Better. And I am joined today by our incredible partner, Rupa Health. We have Jenna Bias, who's their onboarding manager, and joining us in a little bit, Dr. Kate Henry, who is the head of medical education at Rupa. So welcome. All right, so what we're going to talk about today is really how you can streamline the lab ordering, your lab ordering workflow, and easily access over 35 specialty labs with the Practice Better and Rupa Health integration. So we are going to talk a little bit. We have folks from both Practice Better who aren't on Rupa and Rupa customers who are not on Practice Better. So we are going to just touch on the benefits of using both Practice Better and Rupa Health. We're going to give an overview demonstration of Practice Better, and then Jenna's going to show Rupa Health. Then I'm going to show how the integration works, how easy it is, how it's going to save you lots of time. And then for a special treat, we have Dr. Kate Henry to come in as a case study to talk about how she benefited from using the integration in her medical practice. So a couple housekeeping things, or a few housekeeping items. There will be time at the end for questions. I am going to, once we get started, I'm going to turn off the chat just so everybody can focus. And then you can post your questions in the Q&A. We have Sam Nicholson from Practice Better and Matt from Rupa Health. They're going to be in the Q&A helping to answer your questions. This webinar will be recorded, and you'll get a replay email with the recording and other resources that we talked about today. All right, so for those of you who are not familiar with Practice Better, it is an all-in-one private and secure practice management and electronic health record platform, and it's designed for health and wellness practitioners by health and wellness practitioners. So it offers everything that you need to scale your work, your revenue, and your impact on your client's health. And it automates your administrative tasks while delivering an intuitive experience that your clients will love. It also provides tools and automations that will allow you to scale your practice through diversifying your income and scaling beyond just one-to-one consultations that most of us do, but you can also add on group programs, courses, and memberships in addition to those one-on-ones. So Practice Better will support you in offering a better client engagement, support, and accountability on your client's health journey. I do see a question about the slides. So yeah, we will include a link to the slides. That'll come in the replay email. I am going to turn off the chat. I forgot about that. So let me turn this off. Hold on one moment. Okay. So, all right. So real quick. So Practice Better, it helps you to not only run your practice, but also to work with your clients. So just a few things about running your practice. So Practice Better offers scheduling. You can do your clients can schedule all of their appointments with you through Practice Better. So you do not need another scheduling tool. We offer many integrations with tools like Google Calendar, with Zoom, with Stripe and Square. So you can integrate with your favorite tools. We offer charting. We have templates already built so you can keep all your notes organized and share those with your clients. Now the automation. So this is where all the magic happens and where you start to see that time savings. You start to see a better, experience for your clients because everything's set up ahead of time and you're automating things like sending paperwork, like your forms and waivers automatically when clients book a session or a package or a program with you. And you can automate all sorts of things like tasks, like tags, all that good stuff. So we're going to take a quick look at that when we get to the demo. You have your billing, so you can automate, you can send invoices, payment plans, ongoing payments. We also offer protocols, so you can offer your clients food, lifestyle, and supplement recommendations, and you can create templates to reuse those over and over. You can brand your platforms, your logo and colors to keep a seamless experience from your website, social media to Practice Better. We also offer robust reporting, journaling, so your clients can document their food and habits, and then you can comment back to keep them accountable. And then working with clients, we offer the client portal. So they will have their own portal, very intuitive. They can also use it on a mobile app. You can offer programs and courses. So I'm going to show you actually a program that you could create that you could also incorporate education about the labs that you're ordering from Rupa to help offload some of that education. And then we offer HIPAA compliant telehealth for virtual care with your clients. And then many other features that will help you to work with your clients. So I'm not going to get into all of these, but you will see this in the demo. And why we're here today is that we also offer a very robust integration with Rupa Health, so you can track and share your lab results from Practice Better, keeping all the data in one place. So you can integrate lab results within the client notes or under the lab section to quickly and easily visualize a client's lab report. You can choose to either share the results with clients or not share them, and you can just get them organized in the client file and then share them when you're ready. That could be during a session. You can annotate on the labs, share that annotation with the clients. And the integration, it's super easy to set up. I'm going to show you how to do that here in a moment. So now I'm going to turn it over to Jenna. So Jenna, take it away. Let's hear more about Rupa Health.
Yes, thanks, Shelly. Hi, everyone. Like Shelly mentioned, my name is Jenna. I am an onboarding manager here at Rupa Health. Super excited to go over the Rupa platform with you guys today and go over all the ways that you can save time with lab ordering and, of course, scale your practice as well. For those of you who are like, what the heck is Rupa? What do you guys do? We are a streamlined, comprehensive lab ordering platform. So we have partnered with over 30 different lab companies. And what that means is you can come onto Rupa with one login. You're going to have access to these 30 different catalogs where you can do your ordering all in one place. It's estimated that placing an order takes about 2 minutes. So for example, you could be ordering from Genova, Diagnostic Solutions, Access Medical for one patient all in one place under 2 minutes. Pretty amazing. And then beyond that, we really handle everything in between. So from the time that you place your labs, we do things like provide you guys with in-office kits to have on hand if you're seeing a patient in person. If you have a patient who you're seeing via telehealth, we drop ship kits directly to their home address. We provide them with patient-friendly instructions on how to complete those kits. So for things that are going to be done at home, like stool and saliva, we really walk them through that process. For some of our most popular tests, we have really fun tutorial videos that are just really easy and seamless to follow. We provide them with the return shipping information and details to send those off to the lab for processing. We provide sample requisition forms showing them how to fill those out. If they require a blood draw, we send them phlebotomy options too in their area based off their zip code. And then of course, if they need super bills, we generate those as well. And then we have a live support team. So our team is real humans, Monday through Friday. If you have questions, if your patients have questions, specimen collection issues, if they need another kit, they can come to us rather than to you. Again, just kind of giving you back some of that time that's so valuable. Finally, once results are in, you'll be notified via email. You can come to the Rupa platform, manage those results all in one place. You can do things like schedule a clinical consult directly with the lab company if you have questions or need to go over reports. You can manually release the results to your patients. You can create result summaries that are just a really nice takeaway where you can go over next steps and you can send them directly to your patient from the portal. You can generate food plans on Rupa as well. And we have a plethora of educational tools and protocols that you can utilize for your patients as well. So that is some of the time-saving aspects of Rupa. It's estimated that on average, we save clinic staff about 10 to 15 hours per week of admin work when utilizing Rupa. I do just want to touch next on how you can use Rupa to scale. Slide, please, Shelley. We've built out several features that you guys can utilize on the platform that are completely free upon signing up. So the first one I'm going to highlight is Rupa University, which is our educational platform. We have everything from live classes led by industry experts. We have deep dive boot camps, which are 6-week-long courses where we typically highlight one test in particular. We'll go over the results. You get a test to utilize on yourself, so you have a set of results to manipulate and work with throughout the course. We also have magazine articles covering pretty much every health topic you can think of, along with protocols and a lovely podcast that Dr. Kate actually hosts. So definitely check out that. Like I said, it's all free to use, whether you're just looking to kind of expand your knowledge or you're looking to kind of branch out and get educated on different tests to incorporate into your practice. Definitely a great place to start. Another great feature is Lab Shops. So Lab Shops was created as a way for you guys to build out a custom e-commerce page to make testing available to your practice community or educational program participants. This is a great feature. It takes about 5 minutes to create, which is super quick and easy. Once it's created, it actually generates a link that you can then use on your website, social media, or you can send directly to your clients or patients. And this tool I see most often utilized if you are looking to branch beyond that one-to-one relationship and branch to a one-to-many setup, whether you're providing a program or just educational content around lab ordering. This is going to be a great feature for you. Next is our food plan generator. It's highly specific. You can tell it how many meals per day you want, any preferences, dietary restrictions, calories or nutrients per gram that you want in the meal. It generates in about 30 seconds to a minute. And the beautiful thing is it's completely editable once it's created. So you can really customize it to your patient's needs. It just kind of gets the ball rolling and takes off some of the legwork in the beginning. And then of course, like I mentioned, we do have evidence-based protocols that you can utilize and implement in your practice as well. Slide, please. Awesome. And then one thing I just like to highlight is Rupa is really not a one-size-fits-all. Our settings are so customizable that really you can set it up in a way, regardless if you're seeing one patient a week or you're a multi-practitioner clinic seeing 50 patients a day. It's really designed to meet everybody's needs. So you can order in-office kits. You can simply only do drop shipping. You can invite team members as your team grows and evolves. You can integrate with beautiful EHRs such as Practice Better. So really, the sky's the limit as far as options. And with that, so I think for now, what we'll do is I'll go ahead and share my screen and jump into the platform, and that way you guys can see for yourself.
Yeah, Jenna, can you So there's a couple questions about Rupa being available for Canadian practitioners. Could you answer that, or Matt?
Yeah, absolutely. So I did see also in the chat that we have some New York and New Jersey practitioners as well. So there are a few stipulations right now as far as shipping kits. So currently we cannot ship internationally. So if you are an international practitioner, but if you have a US license, you can use your US license for US patients. We just wouldn't be able to ship if you had patients in, for this instance, Canada. Or if you're a licensed physician in another country, but you have US patients, you can utilize a service called physician services that would still allow you to practice as a Canadian physician or whatever the title may be through that route, which happy to answer more questions about physician services because it's kind of a talk all in itself. And then as far as practitioners who live in the states of New York, New Jersey, or Rhode Island, those three states unfortunately have some more difficult laws around billing and shipping. So when I get in the portal, I can show you how you can denote which tests are available to your patients in those states. But just know at this time, it is going to be a little bit more limited compared to the other 47 states.
Yes, so as we move on, Matt, who's here from Rupa, who was answering questions, he is not able to get in the Q&A. So I did open the chat. If you do have Rupa questions or questions for Rupa, feel free to put those in the chat. And then some of these we'll get to at the end of the webinar as well. So Jenna, are you ready to share your screen?
Yep, let's do it. It looks like, okay, perfect. Alrighty, awesome. Okay, guys, so once you've signed up for Rupa, this is going to be the sign-in page. The sign-up process is really quick. It takes about 5 minutes. And you'll see here that it's going to bring you to your clinic dashboard. Eventually, this is where all of your patients and results will live. But to start, I'd just like to show how quick and easy it is to place an order on Rupa, which you can always do by utilizing this Start an Order button in the top right corner. Now to input patients, you only need their first name, last name, and email. So we'll go ahead and add a new patient here. And that is going to take you to your ordering page. Once on the ordering page, you'll see I have lots of favorited tests that I have saved over the months. This is just a way for you to even make this process more quick. So if you have bundles that you've created that you want to save or singular tests, you can save those, and that way it's just a one-click add to your cart over here. You have several ways you can customize this order. So you'll choose the send out date. If you're a multi-practitioner operating clinic, you can choose between who is actually the signing physician for this order. You can add your own custom fee here. This is editable per order. So you can title this follow-up fee, service fee, interpretation fee, and you can change the line item amount dependent on the situation of the patient. Down below, you can choose if you want to pay for the order up front as the practitioner by checking this box. This would mean that you would then be collecting payment from the patient after the fact. Otherwise, you can leave this blank, and we're simply going to send this order to your patient and prompt them for payment. You can add notes to the patient. You can send a note to Rupa if you need anything particular about this order, such as requesting expedited shipping. You can add an ICD-10 code to the order. So it's a searchable database. You don't need to know the code, you just need to know the keyword. By adding this ICD-10 code, Rupa is going to automatically generate a super bill that we then send to the patient so they can bring this to insurance to collect possible reimbursement. And then the final choice you have is whether you want to email this only or email and text to the patient, and then you'll simply send to patient. So the process really is that simple. Once you've gotten acclimated with the platform, like I mentioned, it can take about 2 minutes to place an order. And then real quick, I want to show you what your patients see on their end. So you've placed the order. Your patient's going to receive an email from us. Now, if your patient is paying for the order, the email is going to look very similar to this. We ask them for their shipping details, if we're shipping the kit directly to them, consent for the order, and then they would upload their payment details. We're really transparent about the pricing, and along with the shipping information and average process sampling time, so they are aware of the timeline of, and what to expect next. Now, if your patient's paying for the order, they're going to have the option to use credit, debit, HSA, FSA, or we have a 3-month payment plan that's interest-free. So really helpful to kind of break up some of those tests that can be a little bit pricier. Within 24 hours of payment, we will notify them when their kits have shipped. We send them personalized instructions on how to complete the kits. We send them those 3 to 5 phlebotomy options based off of their zip code. Sample requisition forms, just showing them how to fill those out, what to fill in, what to leave blank. And then this is the email you'll receive once results are in. So you placed the order, your patient fulfilled the order, you got the email now that results are in. So I'm back here in our dashboard. And this is where all your results are going to live. So you'll see here, you can track orders based off of the status, whether it's a draft order, in progress, results are in, or results have been reviewed. Once results are in for a patient, this is where the beauty of the platform really kind of shines, where you have several capabilities. You can go to the details of the order here. You can mark these as reviewed, schedule a clinical consult, send them directly to the patient, or download if you need them a copy for your own records. You can create custom result summaries here that I kind of touched on earlier. And then from this view, you're just going to be able to see and manage results as well moving forward. Over on the left-hand side, this is where all of our other features or custom settings are going to live. So I'm going to quickly breeze through these. The catalog here is for you. Once you've signed up, the catalog is free for you to browse. You can see pricing, details of orders. I did want to touch on in the catalog for our practitioners in New York and New Jersey. Here's where you can come to the state restrictions dropdown. And if you have a patient in one of those states, you can simply toggle that option on, and it's going to filter which tests are available to be sent to patients in those states. Learn About Labs is where our educational platform is, where you can view those live classes and boot camps and magazine articles. You can manage your in-office supplies from the portal as well. And then within settings, this is where you can really customize Rupa to fit your practice's needs. So if you want to release results automatically, you can toggle that on. You can create custom test bundles. Within clinic settings, I do like to highlight this, is where you can integrate with Practice Better. So it's really quick and simple. I know you can do it on Practice Better or on Rupa, really whatever your preference is. You'll come in, add integration, and simply connect to Practice Better here. You can invite team members if you're having multiple practitioners that you want to function under one Rupa platform. You can denote one person to be the main point of contact. You can also download transaction reports if you need to track that over time, or add your own custom fee. And you can also add yourself as a preferred phlebotomist. So I talked a lot about drop shipping kits and finding phlebotomy for patients. But if you perform blood draws in-house, you could simply add yourself here. And by doing so, we're going to automatically include you as the first option that we send to patients. And then that way they still know that they can come to you or other options in their area. And finally, there's a lab shop feature here where you can create that e-commerce store that I mentioned, as well as the food plan generator down below. So I know that was a ton of information. I will stay on for question and answers at the end, but that was the platform in a nutshell. I'll go ahead and pass it back to Shelly. I think she's going to go over Practice Better next.
Thanks, Jenna. I look at that and think, I really wish I would have had that when I was a practitioner, like Rupa. Oh my gosh, the time it would have saved me.
Yes.
I did use a lot of those labs. All right, so let me share my screen. All right, can you see my demo here, Jenna? Are you seeing this? Okay. Oh, you're on mute. Okay. All right.
I see you. You look good.
I got the thumbs up. Okay, so real quick, I'm not going to get into a huge demo of Practice. I really do want to focus on the integration and how that works, but just for those of you who are not familiar with Practice Better, what we're looking at here is your dashboard. Everything is super intuitive. So you can click up here and you'll see these other options. So I mentioned earlier your calendar, and you can actually sync this with your personal Google Calendar, but all of your appointments, everything's going to be on here. It's just amazing. And then you can look at all of your bookings here to see what's upcoming, whether it's a one-to-one or a group booking. And then over here under my practice, this is where you can set up your profile, your business and personal profile. You can actually set up all of your services. So your discovery calls, initial consults. So this is where you set up your services, and then you can create packages. So another huge time saver, and just to keep you and your clients organized as far as like if you're working with people over time and you want to sell a package that includes multiple services, once you set this up, Practice Better will manage that package. So at any time, you or your client can go look at their packages and see how many sessions they've already had, how many they have left. And so I used to do all of that, excuse me, in spreadsheets. So it was a very manual process until I started using Practice Better. And then I just set everything up in packages. Over here, so you can create all of your online forms. So your intake forms, assessments, questionnaires, waivers, you can do e-signatures. So we have all of that in here, and then that can actually be automated. So here under automations, this is where you could come in and set it up so that when a client books, say, an initial consultation, or when they buy a package, the forms that they need to get just get sent out automatically. I used to even have a session update form. So every time I was going to do a coaching session, I wanted the client to just give me some updates on how things were going, what they wanted to focus on. So I set that up as an automation for them to get that form 3 days before each of those follow-up sessions. So I didn't even have to think about it. I got an alert that their form was completed, and it was amazing. So I had all the information that I needed to make the session as productive as possible. We also have our protocols that I mentioned earlier. So this is where you can create these templates for food recommendations, supplement recommendations, and lifestyle. So once you create these templates, you just reuse them over and over with clients, but you're going to personalize it for each client. You just don't have to start from scratch. So we have those set up. And then lastly, I want to show you under our program. So if you have access to programs, depending on what plan you're on, this is a really great way to try, help you offload some of the educational. So if you're ordering a lot of Dutch tests and maybe you focus on hormones, stress, things like that, you could create, this is just a sample of a program where you could teach them about stress and hormones and kind of weave in their education about the Dutch test and like what to expect. So maybe they get access to this program right when they sign up with you. You're still getting the test kit to them. So they're kind of waiting to get the kit, give the specimen, send it back. So in the meantime, they can go through this program and watch videos, get handouts. All of this would be automated for you once you set it up, and it just keeps them engaged while they're sort of waiting to get their test results. So you can incorporate that into your program. So let's take a look at where on the Practice Better side, if you want to integrate with Rupa Health, you're just going to come up here to your settings and you're going to go to third-party integration. And then right down here is where you're going to link to Rupa Health. So since I'm already linked, I just have this helper. So it's just going to ask you to log into your account. It literally takes seconds, super easy. And then as Jenna mentioned, you can also connect over on Rupa Health as well. So once you're linked to Rupa Health, there's a couple different places you can go. So you can either under My Practice and Labs, this is where you're going to see all of your patients who you're working with the Rupa Lab. So here that we have the filter. So I'm actually on the team plan. So if you're on the team plan, you can have multiple practitioners. You can filter by what's in draft and what you've shared with the client or what's been archived, because maybe you want to unarchive that lab report. And then any lab status, so in progress, requisition ready, results available, or if it was canceled. So this right here is all of your clients, but you can also find, if we go over here to, I'm going to go into one of my demo clients. So this is the actual client file. So here I can go down to labs. And so this view is just going to be all of the labs that I've ordered or shared with my client Addie. So again, we have the same filters here. You'll see that like these here, it says results available. These are still in progress. So if I click on the three dots, I can either view, I can send a notification to the client that the results are available. And I'm going to show you that in a minute. I can reassign to a different team member if you're on the team plan. I can open it in what's called the client hub. So I can move this around if I have, different tests that I want to look at. So I can open another hub here and move that around. I love the client hub. It's really cool. So if I want to go in here to edit, this is where you can, where if you want to share this with the client, so you could get the lab result back, you have it ready to go, it's organized in their file, but you're just not ready to. So all you have to do is come in here and click this. And then if you want to notify them about the update that the results came in, you can click that. And then here is the actual report. So that came over automatically from Rupa. But if I had other files, maybe some handout or something that went along with the Dutch test, I could attach that. So let's go here. If you just click on it here, this is where, like, if you wanted to annotate, so you can write in your own private notes about that report, but then you could also share those notes with the client as well. And then again, if you want to send a notification to the client, so it's similar to what I was just showing you before, you can archive or delete. So if you archive it, you can always bring it back later, but if you delete it, it will be deleted. And then here, this is where you can view. I don't know if you're going to see this or not. It's a little pop-up. Jen, I don't know if you can see this report, but basically it opens in a window, so you can zoom in, zoom out. It's just a document viewer, and then you can easily download that report. So how you would actually order that is if I go back over here, I'm going to go to labs, and then this little red button here, you can just click on that, and then we have create Rupa order. So if I click on that, I'm going to get a window. I select which client I want to order. And then it's going to take me to the Rupa dashboard. I'm not sure if I open this, if you're actually going to see it. So I just am logged into Rupa over here. So it would just take you right to the dashboard and it would pull up that client. And so then I could come down here, search for whatever test that I want. If I wanted another Dutch, you're just going to add it to the cart, just what Jenna was showing earlier. But the nice thing is, over here, like the email address, so if this is a new client to Rupa, it's going to pull over that email address from Practice Better. And so you can just put your test in the cart, you can put notes to the patient, notes to Rupa, and then you're just going to click send to patient. And then it's going to show up over, whoop, and then it's going to just show up over here. So that's really it. It's just, again, it's just keeping everything in one place. It's organized in the client file. it's really just a huge time saver, and it makes it a really nice experience for the client as well. So I'm going to head back over here. I'm going to see if Dr. Kate, oh, there's Dr. Kate. Awesome. So hold on. I am just going to pull up this slide real quick. We have Dr. Kate Henry, Head of Medical Education from Rupa Health. Kate, thank you so much. I'm actually going to unshare my screen so you can see her. Hey, Dr. Kate, you're on mute.
Literally, how many times have we all heard this since the pandemic started? You're on mute. So nice to see you guys.
Yeah.
Nice. I'm sorry I'm joining late, but I'm thrilled to be here. And actually, a lot of the practitioners I talked to today were like, we saw you're going to be on the webinar. We're so pumped for it.
Awesome.
Yeah. So I'm here to answer questions, but I'm also like, as a clinician who built their practice using programs and then using Rupa Health, I think that this is like a really exciting integration. And I wasn't sure if you guys got to cover programs in lab shops. And if you didn't, I was just going to share my screen real quick and talk about that.
I briefly talked about lab shops. I did not dive in, so go for it.
Yeah, you guys know that Jenna is the queen of doing the sort of overview of Rupa quickly, efficiently, and like giving you everything you need to know. I think I wanted to dive a little deeper with like what you can do specifically with Practice Better in lab shops that I think you guys might really enjoy learning about. So I'm just going to share like my screen real quick. So in Practice Better, in our little demo account earlier, I went and I built a cardiovascular health program. I just gave it a random amount. But one of the things that I know you guys are doing with your Practice Better accounts is really making your education more accessible, reducing the amount of time you need to spend in appointments, educating a client about the basics of cardiovascular health, for example. And you're building programs that do that for you so that then your care is truly individualized during the session. And so one thing that you could do with the program is link a lab shop, which will make your life easier because like you won't have to order labs for your clients for that program. So for example, if you want to do a cardiovascular health program, in the description, what you could say is, hey, do you want to learn about your risk factors and then go through our 6-week course to help you optimize your blood lab levels? When you click this link, what will happen is that it takes you to the lab shop. And so your client is going to get taken to this bundle. They can add it to their cart and then they can check out and they can see like, how does it work? How does this work? Like, what am I buying? What's included? So you could asynchronously order them a, like complete lipid panel with homocysteine and the apolipoproteins and just really get a full snapshot of what's going on with their cardiovascular health, potentially before they even get in to see you. A lot of you have long wait lists, a couple of weeks long. And so you could have a client buy this, get their labs, go through your program before they even step foot in your office. And it's a really great way to give them a great value before they even walk in your door. You'll see I have a couple things in my cart already, but all they do is click add to cart. And what you can do with these asynchronous online programs is you can offer them to more people than just your clients. So because Rupa gives you a signing MD, anybody from any state, we have a physician who's licensed in that state and will sign your order. And then they call them if there's any red flag alerts. And so they could just order this. And then the beautiful thing is they can also pay for it over 3 months interest free. And so if you're someone who's thinking like, how do I democratize access to my care? How do I stop spending my visits educating people about the basics? And how do I let them order labs asynchronously on their own? This could be a really good option for you, as well as just a general lab test storefront with lab shops, because what a client can do is instead of calling your office and saying, can doc, whoever ordered me a vitamin D, like if they're your client and they have your lab shop link, they can do it themselves and then just come in to review it with you. And so we're all just like Practice Better, like at Rupa, we're all about saving you guys time so you can see more people or relax. Like that's important too. So I didn't know if you guys knew about that, like that you could kind of pair those things together. Yeah, exactly. So yeah, thanks for letting me share that with you guys. I'm wondering if there are questions.
Yeah, while we have Dr. Kate on, you guys, what questions do you have for her? Can pharmacists order labs?
Yeah. So with physician services, you guys, pharmacists can order labs, RDs, chiropractors, naturopathic doctors who may have a license but not in the state maybe where the client is trying to order from, if it's an online program. You can do it. A couple other people can have access through physician health services.
Yeah, health coaches, chiropractors, nutritionists. And like Dr. Kate mentioned, there was a question in the chat that I mentioned to her that I would answer it to everybody, because I'm sure it's a common one, but it'll answer hers and probably anyone else's. Ordering access on Rupa is determined by each lab company. So each lab company, dependent on your license type and the state that you're licensed in your settings, you're going to see whether you have access or whether you don't have access to each lab. So if you come on to Rupa and you're like, okay, great, I have access to these 5 labs, but I really wanted access to these other 5 that I'm disabled from, that's a situation where you would want to utilize physician services, because that's going to grant you access to all of them with that signing physician. So hopefully that kind of clarifies. It is a case-by-case basis. So I see a lot of people in the chat like, oh, what can I order as through my FDN program or through this type of license? Once you create an account with Rupa, your lab ordering access is completely accessible on the left-hand side of your portal, and you can see which lab company you're granted access to. So hopefully that helps.
Awesome. I know you answered this earlier, but there was somebody new that came on just recently and was asking about if Canadian folks in Canada can use Rupa.
Yeah, so similarly, it would have to be through physician services if you have an international license. If you have a US license, then you can use Rupa under that license. Anything internationally, you would have to apply for physician services. The caveat is if you're seeing patients in Canada, unfortunately, currently we cannot ship internationally. But if you're located in Canada and seeing patients in the States, then yes, you're in the green. You can go for it.
Another question. So are there instructions for the lab shop that Dr. Kate just reviewed? Maybe we could put that in the chat.
Yeah, when you log into Rupa for the first time, pretty much any section you click on is going to have a tutorial video. And so Jacques will explain lab shops to you. There's like an awesome 10, 11-minute video where she goes through what it is, how to use it, everything you can do with it, all the functionality. So yes, the instructions are there. So you would click on the lab shops tab on the left-hand side to get those. And I see other people asking, is it a yearly fee to add on physician services? So the way that the fee works is that if you're using phys services for an order, there's a $25 fee that accompanies that order to pay for the signing physician and the service where they'll call your client if there's a red flag value. And it's funny, at first, when I started ordering, I had some orders that were placed with physician services, and I was like, I wonder how this fee will go over. But because Rupa's prices are so low and you can pay it over 3 months, no one complained at all. They were happy to have access to these labs. And so it was not a barrier. And in fact, really with physician services and the programs that we ran in my practice, we were able to grow and scale quite quickly. And Taylor is asking, Jenna, this is a great question for you. Where can they check the labs that they're allowed to order?
Yeah, there's only so much I could cover in the demo, but guys, on that left-hand side where I was like, oh, this is where your settings and everything else lives, that's where that lives too. So it will say lab ordering access. If you just click on that tab, it's going to bring up a nice visual. It'll be green and say enabled or red disabled for each lab company.
Bonnie has a great question. What is the difference between using Rupa's physician services and FDN's medical director program to order labs? And I'm not sure if you'll know that. I went through the FDN program and I remember they had a medical director, but I don't think they had all the labs that all the lab companies that you guys are offering. So that might be one difference.
I'm personally not aware of that program, but Dr. Kate, I don't know if you know anything more about their lab ordering.
I'm gonna look it up right now. Yeah, off the top of my head, I don't know.
Well, maybe we can get back on that one.
Yeah, I'm trying to find in the chat. I'm curious too.
So, is there any way on Rupa Health to be able to see the trends? So over time, can you do that?
Not yet, but
Stay tuned.
soon. Stay tuned.
Oh.
we're working on it. So pretty much it's interesting. I think a lot of folks think of Rupa as a lab ordering platform or company. But that is not true. What Rupa does is we do whatever it takes to make functional medicine practitioners' jobs easier. And so we started with labs because that's the thing everybody told us was the biggest headache, right? They're like, I have 30 different portals, 30 different logins. If I want to order somebody a Dutch and a GI map in the same sitting, I got to like log into 2 different portals. I never remember my password, or I have to stock the kits, or I have to ship the kits. It's a nightmare. And so that's the first thing we tackled. The next thing we started to tackle was food plans, right? So people were like, I'm tired of meal planning. I'm tired of staying up till midnight, designing a meal plan for my client. So I don't know if we showed meal plans yet, but like we tackled that next. The other things people said, I need a way to offer labs with my programs and scale so that I can reach more people. Great, we did that. Other folks came to us and said, I need education. I don't want to order a Dutch test and for the first time be in front of my client, like interpreting it. Can you help? Like I want to do my own, and then I want it 6 weeks with the practitioner to ask them live Q&A. So I truly understand the test in and out before I order it for someone else. We created boot camps. We have protocols for you guys. Our magazine is full of a functional medicine approach to blank. Pick your topic: PCOS, Hashimoto's, fertility. We've got a whole write-up for you on like root causes, testing, treatment, so that if you're new to functional medicine, you just hit the ground running and it's easy. Our goal is to make functional medicine easier because that's the barrier right now. Like this medicine takes time. It's difficult, but we have 41 million people every year who die of a non-communicable disease, which means a chronic illness. Like we have to do better. We have to help you guys reach more people. So anything that you want, please tell your customer service person, like type it in the chat. First of all, they're the friendliest humans on the face of the earth. Like we love them so much. They are like your front desk. Like when you order labs through Rupa, you will never have to explain another test again. You will never have to find a phlebotomist. You will never have to resend a kit to your client if your client messes up their lab collection. Like we handle that for you, which I ran my practice for 2.5 years with no front desk. It was just me because of Rupa and Full Script. Between those two, I did really great, right? Like, and a great EHR.
Which
so
also
like
integrates with Practice Better, by the way.
right, there you go.
Yeah.
So like whatever you guys need, please tell us, because we have like a whole Slack channel of just feedback from our practitioners. We track that, we take it seriously. And if you need something, we will try to build it for you.
So, Dr. Kate, can the doctor on Rupa help practitioners to get the prescription of a continuous glucose monitor?
Not yet.
Okay.
Yeah, we don't do that yet. But again, please type that in your customer service box on Rupa and we will track that.
Does Rupa offer labs for mold toxicity, Lyme, blood work for chronic inflammatory response syndrome?
Yeah, let me actually take you guys, let me take it into the back end of my Rupa account so I can show you how you would find this information. So let's say, let me share my screen. I love that question. Someone is wondering, I clicked the Learn About Labs tab in the dashboard, and someone was asking, do you carry this thing, right? So one of the things that you could look for is like, do you have tests that test for mold and mycotoxin testing? One of the things Rupa does to make your life easier is we pre-build lab comparison tools. So what you can do is look at what are all the mycotoxin panels that we stocked when this was built. We may have added some more recently. How much do they cost? What do the sample reports look like? How many biomarkers do they include, right? So like this one tests for 29 biomarkers, this one tests for 12. What are they? And I would go through this with my clients real time, because they would come in and say to me, I want to do a mycotox panel. I want to see if I can, if I'm filled with toxic mold, right? And I'd be like, okay, well, how do you want to test, right? And here's your options. Here's how much every single one costs. What do you want to do? And so the informed consent conversation flowed really well with this. And I could even just give them the link in their plan to take home and like discuss with their partner. So this was really, really helpful. The other thing that we have is Learn About Labs. And so if you want a live class on mold, for example, you can go find one. We have like tons of live classes, probably, at least dozens at this point. And you can also search. So this will pull up live classes, boot camps, podcasts, like, what do you want to know about mold? Chances are we have either an article, a podcast, a boot camp, or more about it. So hopefully this answers, I would love to know if this answers whoever asked that question. And if not, what else they want to know, because I will help them find that. But that's
Are pharmacists able to consult directly with the lab companies about patient results?
That's an interesting question. So we have a tab in Rupa where you can schedule a clinical consult. And
So
Jenna,
they can, it's just, it has to be a test that you ordered under your pharmacist license. So that is the one stipulation with the clinical consults. If you order a lab under physician services, unfortunately at this time, the labs aren't able to do the consults with those orders. Again, something we're actively working on to hopefully help accommodate. But for whomever has the pharmacist license, you can look at which test you're enabled for. If you order those under your license, then yes, definitely you can schedule the clinical consult.
and that's something on the labs end, guys, not on ours. So some labs just have a policy where like they don't consult with certain providers, or they don't consult with a provider who didn't directly order the lab. And so that's more of an industry thing that thankfully is changing. But chances are we have something that will help you enough for you to feel really confident before you order the test and then in interpreting the results.
So we have a question about insurance. Can labs be submitted to insurance for reimbursement by insurance?
Jenna, you want to
Yeah,
take this one?
so yeah, in that checkout portion, there's an option to add an ICD-10 code. Whenever that's added to an order, Rupa automatically generates a super bill we send to your patient. They can bring that to their insurance for possible reimbursement. So that's the process that we have right now. And then of course they can use HSA and FSA upfront if they have those as well.
So regarding those boot camps, do you offer CEUs for those?
Not directly through our portal, but you can apply for them based on the content with your CEU provider or your board. However, I will say we probably should, because like they're excellent. It's interesting, like our GI map live class yesterday, like I had 3 people sign off because they were like, this is too in depth for me. I'm a beginner. Goodbye. And we're like, oh my God, wait. We're like, hold on a second. Like they didn't watch the pre-recorded content, which is why that happened. And so we called them and we took care of them and they're happy now, but they're in depth. And we bring in the experts to teach you guys. And so, I mean, I sit in CE presentations all the time and like, we have a very high bar here. So you will learn a lot from them. And somebody asked, does Rupa offer discounts for practitioners to test themselves before recommending to patients? When you buy a boot camp, none of them are over 4 or 5. None of them is in the 500 range. They're all under $500 and they all include a test. So for like $400, you can get your own Dutch test and 6 weeks worth of material and 6 weeks worth of mentorship with Carrie Jones, who is like, I can't even say enough good things.
The Dutch queen.
The Dutch queen.
Yeah.
And no one knows more about Dutch than Carrie Jones, right? So like, not only did you get to kind of be her bestie for 6 weeks, but like, and ask her about what your test means, right? But you can submit case studies of your clients and say like, I'm stuck. Can you help? So in that way, yes, that's how you can get the test and education. And it's that sort of kinesthetic experience that I find is really helpful for docs when they're first ordering a test. Like you get the kit, you collect the labs, you send them in, you get the report, you hold it in your hands, and like then you just feel a lot more comfortable ordering it and explaining it to a client.
Lots of love in the chat for the Rupa boot camps. That's awesome.
We do have 2 more questions about the boot camps. I was just going to touch on real quick. Someone asked, are the boot camps only for doctors? No. Again, anyone can sign up for the boot camps. If the test that's being highlighted, you don't have access to order with your license type, you can apply for physician services and still order the test for yourself with physician services. I actually am in the GI boot camp right now myself and use physician services to order it. So I am living proof that you can do it. And then the other question was, which is better? I potentially need to order a Dutch test for a patient. Should I order the test and do a clinical consult or register for the boot camp? So it's a bit of a difference, right? The consult is going to be one phone call with somebody at Dutch going over your exact results for that one patient, Whereas the boot camp is a 6-week course. It's going to be really thorough. You're going to learn how to interpret the test, go over lots of case studies, and you're also going to have that educational content to refer back to. So it kind of depends if you're willing and able to spend that money up front for the course. It's going to help you to, order those tests and interpret them for years to come versus just getting guidance on that one particular test. So hopefully that helps differentiate the clinical consults.
There's a question about teams, and Shauna, I'm not sure if you're referring to in Rupa or in Practice Better, but Sam is one of our team's experts, and I don't know if you can unmute yourself, Sam. There's just a question about, do all practitioners have access to all resources or only the owner of the team?
So that's a good question. So in terms of resources, that can be controlled by the team owner of the account. So when the person who registers for the team plan is inviting team members and setting it up, they can control what each team member has access to. So I have seen, using labs as an example, that some teams will provide access to each other's labs, whereas other teams will only focus on their own labs. So you can control basically, and that applies to everything on the platform, like which clients team members can see, what areas of the platform they can see. That can all be controlled by the team owner of the account, if that answers the question.
Yep. Thanks, Sam. All right, so thank you so much. We're gonna kind of wrap this up since we're low on time, but I am just so happy that Rupa Health was able to do this collaborative webinar. I feel like I learned a lot. Thank you so much for your time. I'm actually going to re-share my screen just for a moment. And so here we are going to, Matt, I know you're going to put some links in the chat. I am going to put this link in the chat for those of you that want to sign up for Practice Better. We do have a promotion going on here. So let me pull this up. So if you're new, this is for new users, you can put in the a discount code Better Together, and you'll receive 20% off for 6 months on any of our paid plans. So that is a great summer promotion for you. And then lastly, sorry, if you haven't already, talking about programs, if you're looking to create a program or you just want to add some or course to your services, we have the program summit coming up in a few weeks, August 9th and 10th. So I'm going to put this in the chat here. Just grab, this is where you can register. Oh, Kathy's excited for the summit. Will the summit recordings be? Yes, absolutely. But you do need to register. So all you have to do is register. Hopefully you can come live, but if not, you will definitely get the recording. So thank you guys for all your amazing questions. Thank you, Jenna, Dr. Kate, Matt, and Sam. This was amazing. From the chat, it looks like everybody else felt the same way. Do you have anything else you'd like to share, Jenna or Dr. Kate?
Just want to say thanks for hosting us, and thanks for everyone for attending, and for all the great questions. It was fun.
Awesome. All right.
Yeah.
Everybody,
Thank you, guys.
yeah. Have a great rest of your day and week, and we'll see you soon. Bye.